Okay, Dr. RJB, and I wanted to talk about back pain rehab. What I'm talking about here is that if you just have a simple type back problem, which most of the time is muscle spasm problems or some minor issues with the vertebrae and discs, you can kind of take care of that yourself. Definitely, if you have a herniated disc that's pushing against a nerve, none of this is going to apply. You're probably going to wind up having to go for surgery for something like that. What I'm talking about is something that's a little bit more simple, where you have a situation where the back is stiff, is painful, you're having trouble lifting things, having trouble bending, but no neurologic difficulties. Basically, the big problem with the back is that it's constantly having to keep us upright. We're an animal that basically walks on two legs instead of four. And the animal that's going on four legs, their back is in a stable position, but our back has to pull us upright and then maintain that posture while we walk on two legs. Because of this, our back muscles can get very tired. And when they get to the point where they're tired, they're more easy to strain at that point. When you got a muscle that's been strained, it can have like a small injury, and then you have pain. If this was a strain of, let's say, your thigh muscle or your calf muscle, you'd be maybe limping a little bit for a few days, but everything would be okay, and pretty quickly you'd get better. With the back, because you're constantly using the back muscles all day long, it's hard to give the back a rest. Even if you decided to sit, you're going to have to use your back muscle to sit upright. You don't. It's difficult to rest the back muscles. The big thing with the rehab then is trying to make those back muscles stronger. Exercise to rehab the muscles is a good idea. Now, sometimes when people have a backache, they're thinking about stretching the back. It's probably the worst thing you can do if you're having a back pain, to try to stretch the back, because the back muscles are already in a spasm. You try pulling on a muscle that's in a spasm, you could injure it further and cause more problems. What you want to do is strengthen the muscles that support the back. Now, I've talked about my patients when I was in practice about the bow and the bowstring. The bow that people use to shoot arrows, if there's no string on it, it wiggles. You can't do much with it. Once you put the string on and tighten it, then the bow is strong, and you could probably even pound a nail with it. So the string gives the bow strength. Without the string, the bow is very flexible and doesn't have much strength. The string in this case is the muscles in the front, the stomach muscles. So basically, when your stomach muscles are good and strong, they support the back and they balance it. Now, we have muscles that are in opposition. So your thigh muscle is in opposition to your hamstring muscle. As long as both of the muscles are the same, no problem. If one muscle is weak and the other one is strong, that's going to be a problem. Either the strong muscle will go into spasm, or the weak muscle will try to fight and will have problems on the other side. So you want both to be approximately as strong, basically. So you want the muscles in the front of the body to counteract the ones in the back. The other muscle that gets involved many times is the hamstring muscle. The hamstring attaches to our pelvic bone. It's basically the bones that you sit on where the hamstring is attached. So the sit bones have an attachment of the hamstring muscle. And then, of course, the hamstring goes down to your lower leg, so it can pull your leg back. But because it's attached to the pelvic bone, when the hamstring moves, it pulls on the pelvic bone, and that is attached to your tailbone. So by moving the pelvic bone too much, it moves the tailbone too much, and then that's movement is transmitted up the lower spine. The problem with this is that if you have a tight hamstring, you're going to have some problems because that tightness is going to pull at the pelvis, which pulls at the tailbone. So one of the things that you can do is not stretch the back, but stretch the hamstring muscles. By stretching the hamstrings and getting some lengthening of the hamstrings, it gives you more play and takes the pressure off the lower back. The quadriceps, the thighs in the front, should be strengthened so that when we are doing things like lifting, that we use our thigh muscles to do the lift instead of our back muscles trying to lift. And that also goes into good lifting technique, which I actually talked about in a previous video. So you want to be strengthening the quadricep, strengthen the stomach muscles, and then the hamstring muscles you want to stretch to lengthen them and take the pressure off the lower back. By doing this, you can make the back a lot stronger, take the pressure off the back, so that when you are doing things, you're not constantly pulling the muscles or putting it into a spasm. I can tell you that maybe 5 or 6 years ago, I would try to bring the groceries in to help my wife, and then I'd have to go lay down because my back hurt so much. And all I was doing is bringing in some small groceries, but it was just the fact that my back wasn't strong. Since I started doing some weight training to strengthen my muscles, now it's much easier for me to do lifting. Even if the package is quite heavy, let's say 75 or 100 pounds, I can squat down and then drive with my legs to lift the box, and I don't use my back muscles at all. So good lifting technique is definitely something that will help prevent your back from going into spasm. All right, so this is some of the basics of trying to take care of your back. If you do have back problems, it's a good idea, like I said, to kind of strengthen the front muscles and loosen the back muscles. But don't stretch your back muscles. Stretch your hamstring muscle. All right, take care.